Michelle here. Throughout our discussions on technology and nursing education, we have touched on several subjects. Today, as my final thought, I wanted to explore how far our profession has evolved related to advancements in technology and the technological future of nursing. As far back as we can research, nurses' ability to identify care gaps and their commitment to improving patient care drives nurses to act as innovators, especially in an ever advancing technological landscape. By implementing new technologies, nurses position themselves at the forefront of driving change within a healthcare system. In World War I, nurses acquired invaluable skills in promptly addressing head, chest, and abdominal wounds, implementing triage to identify immediate care for specific injuries, and understanding the repercussions of head trauma. In response to the needs of wounded soldiers, nurses advocated for the development of plastic surgery, physical therapy, and occupational therapy, bringing about revolutionary changes in healthcare for both wartime population and future generations. Nurses face the daunting task of managing large numbers of patients among minimal resources and in perilous, high stress environments, while delving into the psychological impact of war on soldiers. Nurses pioneered antiseptic techniques to introduce prevention and infection and reusable resources to be able to care for patients and introduce new technologies of sterilization to control infection rates. This period fostered the cultivation of critical thinking skills among nurses. They became adept at quick decision making, effective problem solving, and the application of sound judgment and intelligence in the face of challenging circumstances. The enduring impact of these wartime experiences contributed significantly to the evolution of nursing and healthcare practices. Innovation has advanced technology that enables nurses to provide for patients. Incubators and NICUs provide life-saving environments for premature babies to thrive. The addition of mobile phones and web cameras have improved quality of service in nursing and brought comfort and support to families so that parents can have virtual presence with their baby, reducing anxiety and stress and decreasing travel expenses for parents. Nurses use telemed to follow up on clients in rural areas so families would not have to travel for care. Nurses use mobile phones to support clients living with HIV and AIDS to improve their adherence to antiretroviral therapy. Without many of these technologies and without the motivation of nurses to implement positive changes in the industry, care as we know would be drastically different. Information and communication technologies have provided interprofessional communication such as electronic medical records, institution information systems, and monitoring technologies have greatly improved patient outcomes. Electronics such as laptops, mobile phones, and tablets have helped clients manage patient symptoms and conditions through web-based interventions and have helped to provide patient education. Automated messaging systems to remind clients of upcoming appointments and treatments and schedule times for medications has had an overall increase in positive patient outcomes. Nursing informatics technology and communication is continually evolving as new information, technologies, and communication emerge and incorporated into nursing curriculum. Nurses provide innovation in education delivery by integrating new technology and research into the nursing field. In nursing education, simulation, such as teaching technology, has been a huge advancement in practicing technical and non-technical skills using high and low fidelity mannequins designed to provide real-life scenarios. Simulation allows students the ability to actively learn as clinical settings are realistic and errors are discussed immediately to help foster learning outside of ordinary situations through evolving patient developments. Innovations in nursing through a historical lens demonstrate that advancement begins with nurses who recognize the disparity between the care they are giving and the care they want to provide. This drive to do better is the motivation needed for change in the nursing field. Nurses have been able to promote the discovery of new technologies in their field and are often willing to put themselves out there in order to provide the best possible care for their clients and in order to make advancements for the sake of future patients. When innovation is combined with new technologies, the effects can be far-reaching. It is the responsibility of educators, leaders, and upper management to cultivate innovative culture of nursing. With the right support and working environment, the nursing field will be able to see many more advances and breakthroughs. Nurses who graduate between 2020 and 2040 will largely take over the workforce, bringing with them a new culture of nursing. Educators are leaders of tomorrow and will encourage innovation and technology advancements, and the research required foster an attitude of advancement in nurses to prepare them for the future roles as not only client advocates, but as innovators of their field as well.